Nearly 85,000 Tennesseans died in 2022. Knox County alone saw almost 6,000 deaths. A new study from Forbes ranks Tennessee as the third least healthy state. So what is killing East Tennessee? I compiled statistics to learn what we're most likely to die from here in Tennessee and met with experts to find out what's being done to prevent further death. That search started at the Knox County Forensic Center.
Many people come here to die.
In Tennessee's third largest city with a level 1 trauma center, Chris Thomas sees death in Knoxville every day.
My name is Chris Thomas, and I'm the Chief Administrative Officer and Director for the Knox County Regional Forensic Center.
It's a path Thomas didn't always know he would go down.
My background's a little bit more unique. I have a financial background, but I'm also military, so I spent a couple years in Iraq back in 04 and 05, and had experience being around mass casualty graves and things like that, so it wasn't really of a concern to me to be around the decedents.
6 years ago, he switched careers to work for the Forensic Center. His team investigates all sudden, unnatural, unexpected, or unattended deaths in Knox and Anderson counties and conducts autopsies for 23 counties. So, what's killing East Tennessee? The Tennessee Department of Health tracks each death across the state by county. Based on the most recent data from 2022, heart disease is killing the most people in Knox County, followed by malignant neoplasms or cancer, accidents, COVID-19, and chronic lower respiratory diseases. Those causes are similarly reflected across East Tennessee.
There are 5 manners of death. Obviously, natural deaths is what most people pass away from.
The Forensic Center isn't always called to investigate, especially for natural causes. These numbers show just the deaths the center worked on, but Thomas says natural causes kill the most people every year.
About 2,000 of those deaths that we're notified of die in local hospitals, and it's usually cardiac is probably the #1 cause of death in East Tennessee as far as what we are reported to from us from those local hospitals.
I think when it's the #1 killer across the U.S., it means that someone has been touched by this disease or this cause of death.
As the American Heart Association's Community Impact Director in Knox County, Nicole Gross sees how heart disease affects people every day.
We're not unique being in the South, and even across the country we see that there are alarming rates of blood pressure not being controlled, diabetes impacting our elders as well as our young kids. We know that there are limitations where people may live where it's not safe or convenient to get to a grocery store or to get to a nearby park for that physical activity. So we really just see that there are pockets where there's gaps in access, and we know that these are contributing risk factors for developing heart disease or having a heart attack or a stroke.
Gross and her team work with local partners to educate the community on heart-healthy habits and make resources like nutritious food more accessible.
We get a chance to connect with our local communities across Knox County and East Tennessee to learn where heart health gaps may be in the community and clinical setting. And our goal is to really ensure that where people live, learn, work, play, pray, and heal are as healthy as possible.
Gross says this starts with educating the community.
It's been the #1 killer for a very long time, but I think we're starting to see where these health factors can start to be better managed. And I think that's where the urgency is really start to prevent so that we do not have to have these deaths occur.
Cardiac problems aren't the only natural killer.
Obviously, cancer's a large population.
It's the #2 cause of death in Tennessee. Cancer in general is, yes. My name is Dr. Sean Jordan. I'm the Chief of Thoracic Surgery at University of Tennessee Medical Center. I'm also the Co-Director of Thoracic Oncology and the Director of Lung Cancer Screening.
Dr. Jordan works with the most common cancer in Tennessee, lung cancer.
It's a little bit unusual compared to other states. Nationally, breast and prostate cancer are actually the most common cancers. Overall, in the United States and internationally, lung cancer is the most common cause of cancer death. In Tennessee, we're a little bit unique in that lung cancer is actually the most common cancer overall, as well as the most common cancer killer.
Jordan says 40 people die every day of cancer in Tennessee. About 11 of those deaths will be from lung cancer.
I think it's because we smoke a lot here, basically, is the short version.
Dr. Jordan says the national smoking rate is close to 11%.
In the East Tennessee region, the lowest smoking rate is still Knox County, which is about 18%, which is still above the national average. If you go to some other more rural counties, especially those on the Kentucky border, the smoking rate for adults can actually get up to 25 to 30%. So we just smoke a lot here. there.
But even if we took away all smokers, Jordan says non-smoking lung cancer is still the 8th most common cancer in the United States.
It's because of those environmental exposures that we have.
Like radon and pollution. No matter the cause, Jordan is working to help people.
The best case scenario for lung cancer is that we want to find it early, because I like to joke that I have the best possible medicine for lung cancer. It's called surgery, because when we find lung cancer early, I can do surgery and increase their survival significantly.
To find that cancer early, healthcare providers like Jordan are encouraging people to get screening.
The problem with lung cancer screening right now is that it's very underutilized, both in Tennessee and nationally. Previously, in the last few years, the screening rate was as low as 4%. On the latest report, it's up to about 13% in the state of Tennessee, but that still leaves 87% of eligible people who have not gotten lung cancer screening who are eligible for it.
That includes people between 50 to 80 years old and those who currently smoke or have smoked in the past 15 years.
The problem with lung cancer is that it usually is asymptomatic, meaning you don't have any symptoms at all until you're at the late stages. So that's why it's so critical to find it at the early stages. And one thing that we can do to find it at the early stages is by screening people for lung cancer. It's a painless scan. It's a low-dose CT scan. There's no IVs involved. Basically, all you do is you get on the table, you put your hands up like that. It takes about 15 to 20 seconds to do. That has an excellent chance of finding a lung cancer, and they found in big studies both here and in the Netherlands that you have a 20% lower chance of dying of lung cancer if you get a low-dose CT scan annually.
Healthcare workers at the University of Tennessee Medical Center are trying to make screening more accessible and eliminate stigma around lung cancer.
It's the only cancer that you get blamed for having, and it's very unusual in that scenario because we say, oh, you're a smoker, you deserve to get lung cancer, and that's not the case. We don't blame anyone else for other cancer. There's something very strange that we have made it okay to blame people for lung cancer. You don't deserve to have lung cancer, you deserve to be treated, and we can treat you and help you live longer.
While healthcare professionals like Dr. Jordan might be experts when it comes to natural deaths from killers like cancer, Thomas is an expert in the 3rd most deadly category of deaths: accidental.
I can tell you, as far as any death in Knox County that's not natural, we know about it. So we have to certify anything that's unnatural. So as I can't speak to the natural causes of death, the cardiac, the strokes, things like that. I can speak to accidental deaths.
In 2023, 905 people in Knox County died by accident, which Thomas says
Can be a wide array of things. Those go anywhere from drug-related deaths to motor vehicle accidents, drownings, infant asphyxiation. Falls is a large cause of death that we have here in East Tennessee, for especially in those in the age of over 65.
Thomas says the most common accidental cause of death in East Tennessee is drug overdoses.
Those have been on the rise for the last several years. We had started on a downward trend from like 2015 to 2019, and then in 2020, when the pandemic came, the drug-related deaths just took off, and we had pretty much 3 strong years of really high numbers in the drug-related fatalities.
It kind of has become very much a part of our community and every community across the country.
As the executive director of Metro Drug Coalition, Webster Bailey sees people suffer from substance use disorder.
We tend to all know somebody who's had troubles with substance misuse at this point. 15, 20 years ago, not as much, but it has found its way into every little pocket of every little community.
It's a struggle Bailey knows not only through his work, but also through his personal recovery journey.
When I first entered the recovery process, for me, the opioid epidemic wasn't really thought about as an epidemic. It was becoming that. It was kind of on its way there. Things have shifted in that realm in terms of the frequency and the prevalence of this issue is much farther and wider than anyone thought.
It's not only more prevalent, but also more deadly.
Another thing that's changed over the last 20 years is potency of substances. So 10 years ago, 20 years ago, the potency of pretty much every substance out there that's in our community, legal and illegal, has changed, and it's increased dramatically.
In 2024, the Knox County District Attorney's Office reports 297 suspected overdose deaths. While the number is staggering, Thomas says that's fewer than previous years.
This year, it seems we have kind of hit that plateau, and we're starting to come downward on the drug-related deaths. And while we don't have our final count as of yet, there's a significant decrease, probably 30, 40% in that range of cases less than what we've had in the previous year. So definitely has been a nice reprieve from having to investigate all those deaths this year.
It's largely because of work from organizations like Metro Drug Coalition, which focuses on prevention, harm reduction, and recovery support.
We're making significant impact with the number of folks whose lives are being saved from an overdose situation. And so last year alone, there was over 400 individuals in the Knox County community whose lives were saved. And this is just the documented cases.
While drug overdoses are going down, Thomas says instances of another killer are rising.
Just the amount of unsafe driving in general that's going on, that seems to continue to be an emerging trend.
Motor vehicle accidents are the second most common accidental death in Knox County, Thomas explains. In 2023, the Tennessee Highway Patrol reports 194 traffic fatalities across its 10-county divisional region. The Forensic Center reported 135 traffic fatalities in Knox County, and the city of Knoxville reports 45.
0 to us is the only acceptable number.
As the city's Vision Zero coordinator, Cody Gentry is developing a strategy to eliminate all traffic fatalities by 2040.
When you hear that, you think this is sort of this moonshot, we're shooting for the stars, it's not achievable, it's just a dream. But it is possible. I wouldn't be in this position if I didn't think it were possible. Just as a society, we have looked at traffic crashes and fatal traffic crashes as just inevitable. Like, you're just going to have X number of fatal crashes every year. You can count on that. We are completely rejecting that. We are saying, no, this isn't acceptable.
He's working with agencies across Knoxville to implement changes. Gentry is coming up on a year working in this role and says projects are underway.
We've done some things in front of West High School. That's the first, what we call a quick build project, and it's with more temporary materials. It's like rubber curbing, and it was, something different that we haven't seen in Knoxville, and it just kind of slowing drivers, making turns, and, making sure pedestrians are safer.
While Gentry and his team of engineers are developing new projects and strategies, he's reminding drivers of their role.
Speed is always a contributing factor. It's, a pretty simple concept that if this crash happens, but it happened at a lower speed, the severity is not going to be as bad. So that's a big part, is just getting drivers to slow down. And part of that comes with just reprioritizing things. We're prioritizing safety over convenience, over getting people from point A to B as quick as possible. Now we want to do it as safe as possible.
Education, it all starts with education.
A message every single expert echoes.
Once the problem's identified, we can look at that, learn from that, make changes to try and ensure that doesn't happen again.
I think there's been more education available, more understanding from people in the community.
I think lung cancer right now is probably about where breast cancer was 30 years ago, where we have all these great tools, now we just need to start using them. And it's the same thing for other things. So, colorectal cancer, you need to get screened for your colonoscopy. Breast cancer, you need to get your mammogram. Melanoma, you need to get skin cancer screenings, things like that.
There's also knowing your numbers, making sure that people are aware of blood glucose and cholesterol and blood pressure and what their body weight is and what that means to their organs and what that's doing to impact their heart. So I think there's so much education in that space, but I think if we can simplify it and make it consistent where we're providing that education and awareness, I think that more people will find ways to modify their lifestyle or open up about what they may be lacking and find organizations that can step in to fill that gap.
Thomas says the key to providing that education is first tracking the data.
Knowing what people die from is extremely important because prevention, first of all, starts with understanding where you're at from a baseline. You have to know where the problem is to be able to start working through organizations and groups to find out how to combat the curve.
We are the boots on the ground for families living today with Alzheimer's disease.
Janice Wade Whitehead helps Tennesseans diagnosed with Alzheimer's, the 7th biggest killer in Knox County.
Alzheimer's disease looks different depending upon your community. It looks different depending on interactions with our healthcare providers. So in our metropolitan areas, and this is true in the state of Tennessee and beyond, sometimes people have easier access to go see a doctor, or they're used to that, or if you are employed, you have health care insurance through your employer. So you've had a nice long tenure of having health care issues addressed, and such as heart disease or cancer, or maybe less accident-prone, but you have access to health care. In East Tennessee, there's also, we like to be private and we like to take care of our own. So sometimes we may wait a little longer to seek a diagnosis than perhaps other areas.
But just as Dr. Jordan pointed out is the case with cancer, Wade Whitehead says an early diagnosis is also crucial with Alzheimer's.
Early diagnosis really makes a difference long term. It makes a difference in how you will navigate this disease, because the interventions that we have are so much more effective in the earlier stages of the disease.
The main barriers, she says, come from a lack of primary care.
If you're not seeing a doctor on a regular basis, you may not be picking up on some of the things that can be at risk for developing Alzheimer's.
And our lifestyles.
We still like our food. Our Southern cuisine probably is not the healthiest, and so we haven't, we haven't embraced more of a Mediterranean diet. You'll see that Tennessee kind of falls a little bit behind in our exercise routines and diet.
Which can put you at higher risk for developing Alzheimer's, Wade Whitehead says.
What could we probably do to make the biggest impact? I would say, probably in your 40s, your doctor starts talking to you about lifestyles that may impact, and I would just listen to that. Exercise, and certainly diet, and try to sleep, get good quality sleep, those types of things. And then stay with a physician. Do those annual visits, because by 60 or 65, you'll want to be doing a baseline of where you are cognitively.
Despite the rise in Alzheimer's diagnoses in recent years, she says it's encouraging as more people are understanding the disease and seeking treatment.
I think one difference that we've seen over the years, people call our office and say, I think I may have an issue. Where should I go? What should I do? What are my next steps? 20 years ago, that really didn't happen. People were unaware. They thought it was just a part of the normal aging process. So they were totally unaware that changes may be something that they should look into.
While it's currently the 7th leading cause of death here in Knox County, Wade Whitehead is determined to see a change.
That just means we have a lot of work to do. We need to do so much better in so many areas, whether or not it is education, awareness, early detection, research. We have a lot of work to do in this area. I hope that certainly we one day will get to a point where Alzheimer's is really just a memory.
Connecting people with community resources like Alzheimer's Tennessee is possible as we understand what issues are plaguing East Tennesseans, Thomas says.
I'm a member of several organizations and groups, and we take deaths and we go back and we look at the events that were in that individual's life that led up to that. And we try to find where we could have plugged holes in the gaps as far as the community. Where could we have intervened in this person's life, and where was those options to happen to get him to that point? Education and understanding for the community, obviously, you need to know to wear your seatbelt if you're driving. You need to know not to drive under the influence. You need to know not to have your baby in your bed when you're sleeping. It's just not safe. Other things, obviously, eat healthy, live healthy. We believe that public information and public education is key in preventable deaths.
When it comes to preventing these causes of death, the American Heart Association and Alzheimer's Tennessee both recommend regular annual visits with your primary care physician. Dr. Jordan says getting screened for cancer is key. Cody Gentry reminds drivers to slow down and buckle up. Webster Bailey with Metro Drug Coalition says if you're struggling, don't be afraid to ask for help and seek out recovery resources. For more information from all of these experts, you can visit this article on our website, WBIR.com.